It is known that musculoskeletal conditions have a profound effect on rates of absenteeism, presenteeism, and people leaving the labour market and moving into long-term incapacity and disability. The Occupational Health Physiotherapy pilot programme was established by the Welsh Government to explore the opportunities for occupational health to work alongside physiotherapists to cover more of the musculoskeletal workload and alleviate some of the issues which resulted from these musculoskeletal conditions. The self-referral service was made available to public, private and third sector organisations and included 47 small, medium and large employers representing over 28,000 employees. The service was provided in 3 NHS trusts in Wales and involved 3 stages. Firstly, telephone advice and triage to provide rapid, easily accessible advice and signposting to relevant services. Secondly, face-to-face assessment and treatment, arranged via telephone advice and triage if deemed appropriate, to alleviate signs and symptoms of these musculoskeletal disorders and provided in hospital, workplace, satellite clinics and other settings. And thirdly, a workplace assessment if necessary, to provide essential information to enable early return to work and resolution of a slow-to-recover problem or recurrent musculoskeletal disorder, along with assisting and overcoming fears associated with return to work. The objectives of the evaluation were firstly to explore the economic effects of providing a musculoskeletal physiotherapy service as part of occupational healthcare. Secondly, to carry out a process evaluation to investigate the quality and satisfaction with the services provided from the perspective of service providers, service users and employers. And thirdly, to assess the clinical effectiveness of the service provided by the use of appropriate, valid and reliable clinical outcome measures. The scheme itself secured significant reductions in sickness absence, significant improvements in work-related performance, significant reduction in healthcare resource utilisation, significant improvements in the conditions of employees, significant improvements in their quality of life, significant improvements in pain measures, and highlighted the potential utility of interventions such as this in reducing the impact of musculoskeletal pain on work-related issues, as well as on quality of life. Further, it was shown that the scheme represented value for money and is well within the thresholds considered to indicate relative cost effectiveness. However, despite regular and ongoing marketing of the scheme, the level of engagement by employers was considerably less than had been anticipated when the scheme was being established. And while the impact of the recession on take was unknown, it was unlikely to have been significant. Further, the cascading of awareness within organisations was perceived to have been something variable and something that needs to be addressed if the scheme is to be further rolled out. During the implementation of the scheme, physiotherapists recognised that a more flexible timetabling approach was warranted to accommodate shift workers, for example, and that clinic locations were not always the most convenient for service users. As a result, clinical timings were adjusted and more clinics established to try and match demand patterns that had emerged. All of the professionals agreed that their professional skills had been enhanced, along with the additional confidence acquired as a result of being involved in the complete care of service users, while other healthcare professionals were fulsome in their praise of the scheme and the outcomes generated. They expressed the view that the scheme should be seriously considered to be part of routine service provision within NHS Wales.